I'm going to talk to you about the importance of breathing well for your baby's birth. Breathing is something really simple to do, but what I will say to you is the more you practice long, slow, regular breaths during your pregnancy, the more easy or autopilot it becomes at birth. Breathing well for birth is one of the techniques used as part of hypnobirthing, and all hypnobirthing is deep relaxation using breathing techniques and some antenatal preparation by perhaps using some affirmations or some visualization exercises to maintain deep relaxation for birth and to empower you and to boost confidence as we understand how our body is perfectly designed for birth. Perhaps you drive. If you can think back to when you first learned to drive, I know particularly I felt like this. I had to really mechanically think through every action, what I was doing with the gear lever, what I was doing with the pedals, and really having to think through. And very quickly, within a matter of months, a matter of years, you find that you just jump in your car and you're on autopilot and you're not having to mechanically think through. So I'd suggest to you this is the same for birth breathing, and if you practice just 5 minutes a day, long, slow, deep breaths, it then just becomes autopilot for baby's birth. So your birth partner can support you with this process, and I'd suggest to you that actually to use this as a technique just for enjoying some relaxation, some time out for yourself in any stage of your pregnancy. Perhaps to start doing it when you're going to bed in an evening, when you both lie there, likely tired and relaxed anyway. Ask your birth partner to time you for a minute, and you lay there with your eyes closed and you concentrate on taking a long, slow, deep breath in through your nose and longer and slower out through your mouth. When I practiced my birth breathing, my husband perhaps times that I was having to take 12 breaths in a minute's period. But each week I continued to practice, I got more efficient with my breath, and my breath became longer and slower as I enjoyed that relaxation. So that many weeks in, I was maybe only having to take 7 or 8 breaths in that minute because my breath had become more efficient. There's various hypnobirthing techniques out there that use visualization that you may wish to explore that can encourage you to focus or visualize on taking that long, slow, deep breath. But actually, it's very simple just to do by being in that calm, relaxed environment. Also, to try and be loose, limp and floppy. Any tension that you hold in your body, you hold all the way through into the uterus and the cervix and into the pelvic floor. So I want you to all try this now at home, okay? I want you to put your shoulders up, I want you to clench your fists together, and I want you to clench your jaw together like this, okay? And hopefully you can feel in your abdomen and your pelvic floor that feels really tense. Remember, the uterus is contracting and relaxing with the birth process, as it's perfectly designed to do. As that uterine muscle is working, if you're tensing your muscles on top of that, that is going to feel uncomfy. So the more loose, limp and floppy you can keep the muscles, then the comfier the birth process is going to feel. And I promise you, just that 5 minutes a day, practicing your breathing will make such a difference when it comes for birth. I'm going to share with you some ideas for coping during the birthing process. So coping for those early stages, that piece of string where you're likely to be at home, and then coping in the more active phase of birthing, whether you choose to birth at home or whether you choose to birth in hospital. Some of the measures will be specific to hospital births, but I will explain that to you as we go along. So something very simple, like having a warm bath, can really help with the early phases of birthing to help feel more comfortable and more relaxed. The warmth of the water can help just relieve tension in the muscles and to soothe and feel comfier. If you're going to have a bath, I would suggest to you, if you're able to lie on your side in the water, and by lying on the side, perhaps with your top leg turned out, you are still helping to widen the pelvis. If you lay on your back in the bath, then potentially you're restricting that little coccyx bone from moving back. By lying with your top leg out, you're widening that pelvic ligament at the front of the pelvis, again increasing space, which is going to help the process feel comfier. If your waters have gone, it's important to just use plain water, not to put any oils or additives in the bath. If your waters haven't gone and you've just had a show, then it's safe to use some oils or something in the bath water. The other thing you could try is something as simple as taking some paracetamol. So paracetamol is safe to take in early labour, as it is safe to take in pregnancy. Taking 2 tablets, so 1 gram, can be taken every 4 to 6 hours during labour, with a maximum of 8 tablets or 4 grams of paracetamol in a 24-hour period. It can be really helpful for your birth partner to help you keep track of this, so for them to be aware when you've taken a dose, so that 4 to 6 hours later they could remind you that you could have another dose should you choose to try it. They can also be the person who reminds you that actually you've had your 4 doses in that 24-hour period and actually you're not able to have any more. They can also relay how much paracetamol has been taken to the midwife, so we know whether we could offer you any more within the 24 hours or whether you've actually had your whole dose and are not able to have any more. Massage is also something that you might find really helpful to help the birth process feel comfortable, to help you feel more relaxed. So I would advise you to have a practice on each other during pregnancy, so you both know what feels nice and what is enjoyable. Skin to skin friction can be uncomfy, so you may wish to use a base oil. You may want to add an aromatherapy oil. If you're choosing to use an aromatherapy oil, I would advise you to speak to a registered aromatherapist to get advice about what oils are safe to use during pregnancy or during birth. Having a practice, it might be that during birth, a back, neck or shoulder massage feels comfy, or perhaps you want your partner to massage much lower down, sort of over the base of your back. Perhaps using an aid, maybe a massage ball, or something just as simple as a tennis ball or a couple of tennis balls in an old sock can be a really useful aid for kind of getting a deep, kind of needy massage. I would advise birth partners to listen very carefully to your partner during the birth process. And if you're doing an amazing job and giving her a lovely massage at one point in her birth process, that might be really helpful to her. But as the birthing process advances, she may decide that actually that doesn't feel comfortable anymore. So just keep those lines of communication open between the contraction and respond to your partner's needs. You could also use a slightly different type of massage, almost kind of a light tingly touch. And this type of massage stimulates your body's production of endorphins, which are the hormone that helps you feel comfier with the birthing process. So a light tingly touch, almost like a tickle, can work really well to help you feel more relaxed and comfy. You may choose to hire a TENS machine. A TENS machine is a little device, and you have 4 little pads that you put on the back, as you can see in the photo. And the TENS machine works in 2 different ways. It stimulates your body to increase production of endorphins. It also helps to interfere with the perception of what you're feeling during a contraction. The machine has on it what we call a boost button, and as you feel the contraction, you give the button a press, and that interferes with the perception of what you're feeling. I found it really, really helpful when I had my child. What I would say is TENS machine can take some time to work, so it might not be that you pop it on and then 2 minutes later feel an effect. You may need to have the TENS machine on for 30 to 60 minutes before you find an effect. You can hire one to use, or it might be that you choose to buy one with replacement pads that you could share with friends or family. If you're planning on more than one baby, it's likely it's as cheap to buy one as it is to hire one. To ensure that it's what we call an obstetric TENS, There are TENS machines that are used to treat back pain or sports injury that don't have this extra boost button on. If you are going to hire a TENS machine or buy one, it's important to have a read through the manual and understand how to use it, and likely that you'll need your birth partner to apply it for you. So for your birth partner to be confident that they know how to position it onto your back and how to support you with its use. The only thing you can't use the TENS machine with is the water. It's only 2 AA batteries, but we probably wouldn't advise you to put those in water. And if you did choose to use an epidural to help you cope with the birthing process, the TENS machine would need to come off at that point.